shouldn't. Thank you.
Sir. Thank you, sir. Next speaker is Dr. Aparna S. Free paper 99.
Good afternoon. Our study is on the topic of effectiveness of gonioscopy-assisted transluminal trabeculotomy, also known as GATT, in control of intraocular pressure when added on to cataract surgery in medically controlled primary open-angle glaucoma. So, what is GATT? It is a minimally invasive surgical technique mainly used for primary open-angle glaucoma. It creates a direct pathway for aqueous humor to flow out of the eye through the conventional outflow system. About the surgical procedure, after a paracentesis, a microcatheter or a 50 Prolin suture can be inserted into the anterior chamber. After a 1 to 2 mm of goniotomy incision, the distal end of the microcatheter can be advanced to the Schlemm's canal. With the help of a microsurgical forceps, it can be advanced to entire 360 degree of the anterior chamber. So why GATT? The advantages of the GATT over the conventional surgery. It causes rapid and effective reduction of intraocular pressure with minimum tissue trauma and faster recovery. It maintains a good safety profile and lesser complications compared to the conventional surgery. So, aim of our study was to evaluate the effectiveness of GATT combined with cataract surgery over cataract surgery alone in patients with primary open-angle glaucoma. We used a randomized control trial using block randomization method, and the study population comprises of the patients with primary open-angle glaucoma and cataract coming to our outpatient department and who are willing to undergo cataract surgery combined with GATT. The study group can be divided into experimental group. Those are patients with primary open-angle glaucoma on anti-glaucoma medications undergoing combined GATT and cataract surgery. The control group comprises of patients with primary open-angle glaucoma who are undergoing cataract surgery alone. Preoperatively, both the groups were evaluated for intraocular pressure, visual field, visual acuity, number and type of topical medications. And postoperatively, both these groups are evaluated for the same at first week, first month, third month and 6 months. Visual field only done at 6 months postoperatively. And the time period was 1 year. Coming to the results, this table shows the changes of number of medications from the preoperative period and postoperative period among case and control groups. This is a results of the 6 months postoperatively. 14.3% required no medication among case group and 50% required only one anti-glaucoma medication postoperatively at 6 months, and 35.7% uses 2 anti-glaucoma medication, and none of the patients were using 3 anti-glaucoma medications. So, the change in medication requirement from the preoperative period was statistically significant. This table shows a change of intraocular pressure. The mean preoperative intraocular pressure was 14.4 plus or minus 2.7 millimeter of mercury, which was reduced to 12 plus or minus 3.4 at 6 months postoperatively among case group. This table shows a change of visual acuity. The mean visual acuity was 0.489 plus or minus 0.267 preoperatively, which was improved to 136 plus or minus 0.142 postoperatively. Similarly, visual field, which was preoperatively 2.81 plus or minus 8.96, improved to 4.2 plus or minus 4.82 postoperatively. Since both the groups underwent cataract surgery, which is expected to improve visual acuity and visual field. Coming to the discussion, a study by Liu et al. Reported mean preoperative number of medication was 3.2 plus or minus 1 and mean postoperative number of medication was 2.3 plus or minus 1 at the end of 4 years postoperatively. Similarly, a meta-analysis of trabecular procedure by Richer et al., which agrees with our result, showing that incorporating a trabecular procedure into cataract surgery can yield an additional 4 to 9% reduction of intraocular pressure when compared to cataract surgery alone. For patients with open angle glaucoma, then cataract surgery alone can reduce IOP by 5.4 to 7.6 millimeter of mercury. Or it can potentially eliminate the need for 0.8 to 1 glaucoma medication. By adding a trabecular procedure, IOP may further decrease by about 1.6 to 2.3 millimeter of mercury on an average, equating an additional reduction of 0.4 glaucoma medication. So coming to the conclusion, GATT combined with cataract surgery is a beneficial option for patients with primary open angle glaucoma and significant cataract, providing better management of glaucoma with potentially fewer medication, which can eliminate the financial burden for the patients. These are my references. Thank you.
You have shown that is the slide, Richter et al. Study agrees with your study. That means you are agreeing with the Richter et al. Hello. Understand now? It is not, you are comparing Richter et al. To you. Something wrong.
No, sir, we observe the same result as that of.
That is okay. You have
Yeah.
done, he is not agreeing with you.
Yes.
You are trying to agree. See, basically, your meta-analysis doesn't show GATT anywhere. You only say trabecular procedure.
So,
Number one. Number two, how did you assign cataract with GATT and only cataract? How was it selected?
sir, it was by
Because your criteria is same for both.
yes, sir. It was done by a block randomization method where the odd numbers are taken as GATT and even numbers as non-GATT.
Sequentially 1, 3,
Yes, sir.
5, 7 like
Yes,
that.
sir.
Okay. But the severity did not have any saying on that, duration and severity.
So we excluded the patients with advanced glaucoma and other glaucomas like pseudoexfoliation. We have only taken the primary
No
open angle
mature
glaucoma.
cataracts?
No, sir.
Okay. Okay. Thank you.
Thank you, sir.